The technique you've relied on for 30 or 40 years might actually be the very thing silently harming your health after 60. I know it sounds hard to believe, but a survey in the US found that more than 52% of men over 60 experience issues with pleasure or erectile function not because of disease, but because of the very habits they've been repeating for decades. And many of them, when they come to my clinic, often whisper, "Doctor, I don't understand. Why does something that once made me feel strong and confident now make me uncomfortable and less responsive?" My name is Dr. Benjamin Hartwell, a urologist who has spent more than 3 decades walking alongside men your age. I know well the confusion and sometimes embarrassment that comes when your body no longer responds the way it used to. But let me make this clear. You are not broken. You're simply entering a new stage of life, and if you learn how to adapt, not only can pleasure return, it can actually become deeper and more fulfilling than ever. The real danger isn't aging, it's clinging to old habits with a body that has changed. Instead of forcing yourself to push through like before, we need to start with a more important question. How has your body really changed after 60? Before I share more, leave me a comment. If you've ever felt your body doesn't respond like it used to, type 0. If you believe what I'm about to share will be helpful for you, type 1. After 60, your body doesn't operate the same way anymore. This isn't a loss, it's a natural biological shift. Testosterone gradually declines. Research shows that after 60, men lose about 1% of this hormone every year. That doesn't mean desire disappears, but it becomes less spontaneous, requiring more stimulation and patience. At the same time, your blood vessels change. The tiny capillaries that nourish the penis lose elasticity, making it harder for blood to flow in as quickly. That's why erections may take longer to appear, or may not last if you're stressed. One of my patients once described it like this: "It used to be like flipping a switch. Now it's like waiting for the whole system to boot up." Your sensory nerves also age. Touch may still feel good, but the response is slower and sensitivity fades slightly. That's why the harder you try to speed things up or tighten your grip, the more out of sync you feel with your own body. So it's not that you're weaker, it's that your body is now playing to a different rhythm. And if you keep using the old approach, fast, hard, forceful, you're not building pleasure, you're creating injury. Because what really causes frustration isn't age, it's the 5 hidden mistakes most men over 60 make. The biggest issue I see in my clinic isn't disease, it's habit. Habits that were harmless in your 30s or 40s can become a double-edged sword in your 60s, and most men don't even realize it. Mistake number 1, gripping too tightly. As penile skin becomes thinner and more sensitive, a strong grip can cause micro-injuries to delicate blood vessels. One patient told me, "Doctor, the harder I squeeze, the more numb I feel, not more pleasure." The truth is, it's your hand pressure that's switching off sensation. Mistake number 2, too fast, too soon. Reflexes in the nervous system slow down, but many men still try to rush. The brain can't process signals quickly enough, so pleasure feels dulled. I often compare it to a radio slightly off frequency. The signal is there, but all you hear is static. Mistake number 3, skipping lubrication. As testosterone drops, natural genital moisture decreases. Dry skin plus friction equals irritation, even small tears. Yet many men dismiss lubricants as unnecessary. I see this mistake so often it feels almost routine. Mistake number 4, forcing orgasm. Some men measure success only by finishing. They watch the clock, worry, push harder. But the more you force it, the more your body produces cortisol, the stress hormone, and the less pleasure you feel. It becomes a vicious cycle of frustration. Mistake number 5, ignoring your body's signals. A little pain, some numbness, or just noticing it doesn't feel the same, but still pushing through. This autopilot approach is the real silent enemy. After 60, you're no longer in machine mode. You need to be in listening mode. These mistakes are not your fault. Nobody ever taught us how to update our habits as our bodies change with age. The good news is, with just a few small adjustments, you can completely turn things around. So what's the new formula, the simple steps powerful enough to reopen the door to pleasure after 60? Let me guide you, one step at a time. Think of this not as a technique, but as a ritual of self-care. Step 1. Choose a safe, unhurried moment. Give yourself at least 15 to 20 minutes without interruptions. When your nervous system feels safe, blood flow improves naturally. One of my patients tried this and said, just taking away time pressure made all the difference. Step 2. Breathe before touch. 5 slow, deep breaths, in through the nose, out through the mouth. It sounds small, but breathing is the switch that tells your body you're safe. Step 3. Lubricate early. Don't wait until arousal kicks in. Use a water-based, gentle, fragrance-free lubricant. It softens the skin, reduces friction, and heightens sensitivity. Think of it as your lifelong companion from 60 onward. Step 4. Warm up like a massage. Don't rush straight to the most sensitive spot. Explore around it. Vary the pressure, temperature, and angle of your hand. Some patients have told me that just switching from sitting upright to lying on their side gave them a surprisingly new sensation. Step 5. Pause when needed. If your arousal drops, don't panic. It may return after a few minutes, or it may not. That's not failure. It's simply your body's new rhythm. Step 6. Keep breathing throughout. Every slow breath helps blood circulation and calms the nervous system. Without breath, there's no lasting pleasure. Practicing these steps may feel unfamiliar at first, but within just a few weeks, many men have told me they rediscovered satisfaction they thought they'd lost years ago. Because even if your technique is correct, if your mindset is off, you'll still feel unfulfilled. That's why mindset after 60 matters just as much as technique. Once you're past 60, self-pleasure is no longer just about quick release. It becomes a way to connect between your mind, your body, and even your sense of self-worth. And this is where many men unknowingly carry invisible backpacks, old expectations, performance pressure, and fear of failure. I once sat across from a patient named Harold, age 68. He sighed and said, "Doctor, I feel like I'm running a race I always lose." I told him, "Harold, there is no race here. This is a slow dance, and only when you stop counting the steps can you hear the real music." A few weeks later, he came back smiling. For the first time in years, I felt peace instead of pressure. This is the key. When you let go of the idea that orgasm is the only definition of success, you open yourself to a different kind of pleasure, slower, deeper, but far more complete. After 60, self-pleasure is no longer a test. It becomes a ritual of care. And if one day you don't reach climax, but end the experience feeling relaxed and satisfied, that's not failure. That is success at this stage of life. However, not every change is simply due to age. There are warning signs your body sends that you should never ignore. That's when you need to see a doctor. Not every change is normal. Some signals are like flashing red lights, and ignoring them only makes things worse. In my 30-plus years of practice, I've noticed one truth. Men who come in early often need only small adjustments or minor support. Those who delay usually face tougher consequences. Warning sign number 1. Persistent pain or burning. A little momentary discomfort can be normal, but if every time you feel stinging, dryness, or lingering pain, your skin or microvessels may be inflamed or damaged. Warning sign number 2. Unusual numbness. Sensitivity can fade gradually with age, but if you suddenly notice dead zones with no feeling, this is not just aging. It could be a nerve issue that requires immediate attention. Warning sign number 3. Inability to maintain erections, even in a private, relaxed setting. This often signals a blood vessel or hormone problem, not a personal failing. In fact, it can sometimes be an early warning sign of cardiovascular disease. Warning sign number 4. Overwhelming negative emotions. If every time you finish, you feel guilt, disappointment, or disconnected from yourself, that's a psychological red flag. Mind and body always work together. If one side spirals down, the other will follow. I once treated a 64-year-old man who delayed seeking help, thinking it'll sort itself out. By the time he came in, he had developed chronic skin inflammation in the genital area and needed long-term treatment. He told me, "I wish I had come to you sooner. It would have been so much easier." That's the lesson I want you to remember. So, if you don't yet have warning signs, what can you do right now to protect your health and restore pleasure? Let's start with a short, easy-to-remember checklist. I know all this information might feel overwhelming. That's why I've condensed it into a simple checklist you can start using tonight. No complicated notes required. Take 5 slow breaths before touching. Inhale deeply through your nose. Exhale through your mouth. This is the switch that signals safety to your nervous system. Lubricate early before arousal kicks in. A gentle lubricant softens the skin, improves circulation, and reduces risk of injury. Start slow, keep a steady rhythm. Don't rush to the most sensitive spot. Think of it as a conversation with your body, not a speed test. Just these 3 steps alone have surprised many of my patients, bringing back a gentle, relaxed pleasure without pressure or stress. Because beyond pleasure itself, what truly matters is your overall health. And you might be surprised to learn that mindful self-pleasure after 60 also benefits your heart, your sleep, and even your lifespan. Here's something many men overlook. After 60, self-pleasure isn't just about sex. It's part of whole-body health. Done the right way, with steady breathing, good circulation, and deep relaxation, you're giving your heart, brain, and immune system a kind of gentle workout. A study from the University of Michigan found that men who maintain safe, appropriate sexual activity in their 60s and 70s have an 8% lower risk of high blood pressure compared to those who stop entirely. On top of that, the endorphins released improve sleep and mood. One patient told me, "Not only do I feel stronger, but I'm sleeping deeper and waking up less tired." This means that when you update your old habits, you're not only saving your intimate life, you're preventing heart disease, improving sleep, and extending your years of vitality. This is not just about pleasure, it's about total health care. And let me tell you the story of Richard, a 72-year-old man who thought he had lost everything until he tried a different approach. Richard, at 72, walked into my clinic with eyes full of disappointment. He sat down and whispered, "Doctor, I feel like I've lost my manhood. I've tried everything, but the harder I try, the worse it gets." Those words carried the pain that so many men his age feel inside, but rarely have the courage to speak aloud. We started with the smallest changes, slow breathing, using lubricant early, easing his grip, and instead of racing, letting sensation guide him. 2 months later, Richard returned with a completely different smile. He said, "I'm no longer forcing myself like before. I feel relaxed, and strangely enough, I'm sleeping better and my mood is brighter." The real victory wasn't that he regained the performance of his 30s. It was that he learned to live in harmony with his body's new rhythm. And from that moment on, he no longer felt like a failure. He found peace. Because in the end, your body isn't broken, it's evolving. And as I close, I want to leave you with one important message, along with an invitation to continue this journey together. After all, I want you to remember this. Your body isn't broken, it's evolving. The changes after 60 aren't the end of pleasure. They're an invitation to enter a new chapter, deeper and more meaningful. When you loosen your grip, slow down, breathe evenly, lubricate early, and truly listen to yourself, you'll realize your body still has so much to give. I've seen hundreds of men regain confidence and joy through these small adjustments, and I believe you can too. You are not alone in this journey. Millions of men over 60 are going through the same thing. Together, we form a community where you are respected, heard, and given hope again. If you've found these guidelines useful, type 1. If you've made mistakes in the past but now understand how to fix them, type 0. I'd love to read your comments below, because every story shared can inspire another man quietly struggling just like you. And before you go, I need to tell you something very important. Even if you've mastered the right techniques, there's still one silent habit that can affect your prostate health, something most men don't discover until it's too late. In the next video, I'll clearly explain how self-pleasure relates to your prostate and what you need to start doing right now to protect your long-term vitality. Click on the next video because what you learned today could save you from a major health issue tomorrow.